Welcome to the UK Health Week Digital Summer Series.
Recognising the UK is often at the forefront of cutting-edge technology and innovations in healthcare. The government's recognised that, and they're really promoting, attendance at global events and events like today as well, where we can showcase what we're capable of. Being a UKIMA member, we're a membership trade organisation. All of our members have a passion for offering expertise to international clients.
The key area for me is about the use of new medicines, remove any reluctance to use new therapies.
Every day 5 million people download a health app, and that's increased by 25% since the start of COVID, and that trend is accelerating all the time.
People have more than one disease, and actually some drugs work well in men but not women. Some work well in white people but not black people. Some drugs work well in young people but not older people.
Artificial intelligence gave us that platform where we can analyze things easily, or where to even place restrictions.
And I think we're now seeing, after a very difficult period through the pandemic, that there are some real pressures on that workforce.
We really need to empower and dignify healthcare workers with a mental health condition. We need to amplify their voices because the evidence is clear.
If you want to take a break from being at hospital, you can put on the VR goggles and transport yourself to whatever exotic destination that you wish.
My name is Celine, and I'm the COO of Hearix Group, and we are honoured to be shortlisted for a Future Health Innovations Award.
Do you think there's a movement?
There is a huge movement at the moment. It's really building up. I'm confident we're going to be seeing a change in the next months.
Problem shared is a problem halved that has enabled for the rollout of PPE and things like that.
What we found from our work is that the biggest activator is the healthcare professional who have a touch point with that person or individual.
Hearing loss is called the silent epidemic and goes largely undetected and untreated as a result of the high cost of hearing testing equipment, interventions and treatment.
I'm very pleased to announce that the World Health Organization has just finalised new guidance for countries to develop community mental health services that implement the holistic and recovery-oriented approach.
How much time can we save by moving some activities for some patients online? And how do we ensure that this saving is clearly allocated?
We had better health and well-being, we would be in a better place to face future pandemics.
And so healthcare professionals need knowledge resources that are targeted, not just for not one size fits all anymore, but they want to find out, how should I manage a patient with COVID-19 and heart failure?
Some people are more at risk of digital exclusion than others, but essentially it boils down to having access to skills and motivation.
Most new treatments have quite low levels of quality gains, and the reason is you're competing against already well-established, very effective therapies. So the challenge sometimes is to find those breakthroughs.
It's an honour to participate in this Health Week series, and I want to thank the conference organisers for having created a dedicated space in the agenda to discuss the important issue of mental health and well-being.
Thanks so much, great to be here, and enjoy the rest of the conference.
Thank you very much.
I just wanted to thank you very much for inviting me to speak to you today.
Thank you. Thanks for having me.
Thank you for joining us today. Thank you for your time for the Q&A, and thanks to the audience.